Hi, everyone. Welcome to Crushing Doubts Q&A every Monday at 6 p.m. Eastern, 3 p.m. Pacific. It's great to be back here with you as usual, and we're going to do the usual thing, and that is to answer as many questions as you guys have. And really, a big part of my system is all about asking questions. I found that when I finally found the appropriate places and resources to ask the questions, that when I got answers, it was very helpful. Sometimes it was helpful in getting the right answers. Sometimes it was actually helpful in getting the wrong answers, believe it or not, because as I thought about these answers and they didn't make sense, I was able to piece together why. And in fact, it's part of how my system works is from all of those questions that I asked. But it has become an even better system as you guys ask the questions. And I've been so pleased to have you guys as part of my community. In addition to the fact that because you have a different mind than mine, you help bring attention to other aspects of the work. So we're going to keep looking at it. We're exploring the three columns: emotions, doubt, and power, how they apply in your moment-to-moment experience. And we're just going to keep on answering questions. And the great news is that we're going to keep on doing these Q&As, but they're also recorded. So you can go ahead, go back and take a look at them on YouTube and see what it is that you missed. Every week, we're going to keep cranking out answers. Now, in the meantime, as you guys know, I've built systems out around things as I've gone. It was about 2 years ago that I first went on a podcast. It was with John Strax. And I got a lot of people contacting me from that. And it was then that I realized, oh man, I have to start building out some systems because so many people needed so much help. So I've worked at it. We have the systems built up almost to fully where I want them to be. The book is the next step. I'm going to be working on getting that out too. I am working on it. You guys have been hearing about it. I continue to edit, but it's got to be what I want it to be. And I'm shaping it and getting it there. As soon as we have that, we've got the seminars in place, which gives you the full information you need so you can stop looking all over the place in the mind-body field, trying to figure out where to get your answers. I incorporate the best stuff from all of these great people in the mind-body community, but bring it together in one system that shows you how it all works together. After that, I have the group memberships. So if you still need to work on your moment-to-moment experience and understand it in a kind of real-life experience sort of way, that's what the memberships are for. So come on, www.crushingdoubt.org if you're looking for any of those resources. More resources are coming. The mind-body guides are there as well. And I look forward to helping you. So we're going to jump in. We got a lot of people who have joined us already. Let's see who has joined us on Instagram. This is reminding me of a kids show, like when they say, "Oh, I see this person." There was a kids show when I was a kid called Romper Room. This is what this sounds like. Anyways, put pain in the past. That's Rita. Good to see you. Chuck Brown Productions. Terry. Good to see you. Carrie Nordling. Gracie Lean. Arizona Golf. I think is actually Courtney. Yes, pretty sure. Kazi, that's Karen. Sylvia Sierra, good to see you on Instagram. Sue Conte, Charming L, and Charming L says, hello, Dan. Good to see you. On YouTube, we have Catherine Toomer, who has this news to share. Hi, Dr. Dan. I was gone for 2 weeks of Q&A, during which time my first grandchild was born. So big congratulations to Catherine. She says, wonderful, and glad to be back to you all. So welcome back, Catherine. Congratulations. Very, very exciting. I hear that being a grandparent is in many ways even better than being a parent. You get a lot of the wonderful benefits, but not quite as much work. Personally, I'm not in a rush to be a grandparent, but I'm glad to know that that's waiting for me, years to come. Right now, my kids are 12 and 8. Let's just keep it that way. Okay, Bob says, hi, everyone. Good to see you, Bob. It was good seeing you earlier today. And Dorisa says, hi, Dan and everyone. Dorisa, it's great to see you. Now, we all know the drill. Oh, look, Rita says, hi, Dan, Romper Room and Magic Garden never called my name, LOL. And they never called Rita? Really? They did call Dan, I'm pretty sure, but I don't entirely remember. In any case, I was going to say we could do a preloaded question, but maybe not. Sylvia Sierra has joined us here. Good to see you, Sylvia. Sylvia says, hi, Dan. Thanks for your email about rebound headaches due to medication overuse. I'm still having a hard time being convinced. I feel like when you take drugs, it's going to affect your system. Okay, so let's address two things. First of all, I want to address the broad topic that this brings up that Sylvia is talking about, and that is about whether she's convinced or not. Then there's the more specific one about medication overuse and whether it's going to affect your system. So let's leave that up there. First thing is the broad picture, Sylvia. You're doing the exact right thing. I'm sure you're doing it in part because I told you this is exactly what you're supposed to be doing. Keep bringing your questions. If you're not convinced, it doesn't do us any good. What I believe doesn't actually matter. What I believe can be useful, but it's only useful if you think it's useful, if you see it making sense. So we need to continue answering these questions. So the broad picture, keep bringing the questions. In the specific, Sylvia is saying, if you take drugs, it's going to affect your system. Okay, so let's talk about that. I'll give you my answer to that, Sylvia, and we'll see where this goes. I am not saying that taking medication doesn't affect your system. Here's what I'm saying, though. The doctors are claiming that they know how it affects your system, and I don't feel that they're showing that in any way that's very clear. So what I'm asking the other side to do, the other side being the structural side of things, is to start mapping out why it is they think what they think, why they think the results are saying what they say. So you were talking about a study where lab rats took a certain kind of medication, and then it was shown that there was a kind of cortisol response, I believe. And they were saying, okay, this shows that the medication had a certain response, and then the withdrawal effects led to a certain thing. Listen, it could be that there's more information in that study than I'm hearing, and I'm sure there is. But at the same time, I do not find these studies to be very convincing because they never factor in how the drugs not only affect your physical system, but they also affect your central nervous system. And as a result, they're not teasing those out. It's like a bad experiment where you're not doing a controlled study. They're not separating out the two. If they're not separating out the two, how are we supposed to trust what it is that they're saying? So let me put it to you this way, Sylvia, in terms of the simplest terms that maybe can be convincing to you. I'm not saying that your physiology is not going to be affected by medication, but is it conclusive that it's being affected in the way that they are saying, where there's going to be withdrawal effects? I do not think so. Secondly, they're not factoring in the fact that your mind-body experience is also going to be affected by the mind part of it. You take medications, it's going to change your mind. Even those rats, they were in a different mindset. And the question is, what does that do? So before we say anything about it, I think we need to ask those questions. Let's start there and see what you think from that. Talia, good to see you. Thanks for joining us on YouTube. Okay, Rita says that her name was not a popular name in the 70s or ever. Not even after Lovely Rita, the wonderful Beatles song. I'm a huge Beatles fan, if you don't know that. We have How to Heal Chronic Pain has joined us and saying hello. I believe that is Scotty. Good to see you here. Okay, looks like we actually have time for a preloaded question. We'll load it up. I believe this one is actually from Bob, who is with us today. So Bob, thanks for joining us. And this is a question that you asked in the past. And then Sylvia, I see your question. We'll jump back to it. Bob said, I've been thinking that doubt is the central player. I've been seeing the dynamic between doubt and power columns is where the work lies and results happen. Emotions column highlights what went wrong. The power column shows working with the doubt column writes over old negative emotional column stuff, resulting in power column action steps, resulting in new, more positive and powerful reactions and feelings of safety. It's very well said, Bob. And, you know, you're very good with these kinds of observations. One thing that I've really liked to see, though, is that you're taking these good observations and you're starting to get to a place where you yourself believe them. You're seeing the fullness of doubt. And that is making your power column rise way up. And that gives you a chance to work in the emotions column in an even more effective way. So you're right that doubt is the central player. When doubt is there, it dominates. That's always the case. There's a reason this is called crushing doubt. Doubt is the most powerful influence, but ironically, it is also founded on quicksand. There's nothing there. And so what you're going to find is it's much more powerful when you know your emotional landscape, the emotions column, and when you've got your power column. In fact, if you think about the columns, what's going to end up happening is your emotions column pretty much stays the same. It's the same emotional themes. It gives you a sense of who you are emotionally. Your power column, that can change, but it's all moving towards solidity. The doubt column is a bunch of junk that gets thrown your way. by your own mind, by society, by all kinds of things, by your experiences. And it convinces you of things that aren't true, but it is meant to be shrunk down to zero. So if you think about the columns, you're going to have stability in the emotions column and ultimately the power column. The doubt column is going to have stability by being almost gone a lot of the time. So it's kind of interesting that way. Okay, now Sylvia has a follow-up to the conversation we were having. She said, I read some more studies on this, LOL. Okay, and this shows how people undoubtedly are going to go after more and more information. Makes perfect sense. She says, so they say it's an increase in hypersensitivity of the brain, increase in CGRP, a chemical associated with migraine, cortisol spreading depression, etc. Okay. Oh, and with the rat study, there was a control group that was not given the drug. So no, I understand they're doing a control study. Of course, most studies are going to do that. They did a control study. The question is, did they control for everything? And I would say that they didn't, because they're not controlling for all the variations of what can happen in the mind and what the effect can be. So it's just more complicated than that in terms of having a good control study that says what it needs to say. Here's a good example. An increase in CGRP, a chemical associated with migraine. Hear that word, associated with migraine. To me, this just sounds like a used car salesman. I'm sorry to say it that way. I'm trying to say it, though, in a way that is forcefully in your corner on this, Sylvia, because these studies, they give correlations, but they don't give causality, generally speaking. They just don't. And what I think is better is to look at the whole system of the world as we see it. What are we actually seeing? And I would rather go on anecdotal information, I'll put in quotes, from people who have been able to get off of the medication without rebound effects and have there be mixed results than to trust a study that says, well, we studied rats and there was this association. It just doesn't really all hold together. Rita's making the point that studies are skewed, and a lot of times they really are. And she's also making the point about consensus medicine. This is a big problem, actually. And so, Rita, thank you for bringing that up. There's a lot of group mentality about this, groupthink about it. And science isn't, I think, meant to be used in that way. Science is meant to be the pursuit of truth. It's not meant to be, well, we found these truths, so we're now going to push you in this direction. And I find that that's what these studies often do, or at the very least, that's what they're used for. I don't mean to accuse the researchers of that, because I don't know what was going on there. But I think we need to be very careful about how it's thought about and not jumping to conclusions about this. Okay, Celeste Nova Chrono says, hi, Dan. Nice to join you today. Nice to have you here, Celeste. Thank you for joining us. Let me see if I missed anything in there. Okay, I didn't. All right. Now, Catherine Toomer says, while away to help at birthing of grandchild, many emotions happen, delightful ones and difficult ones, a bit of meltdown on getting back. Just as I realized that my plantar fasciitis was almost completely gone, I began to have rib cage pain. I guess my emotions don't all flow easily yet, and I've repressed a few that I need to attend to. Make sense? Okay, so let's leave that up there. Not only does that make sense, but I actually would say that this is a very, very typical kind of experience. When you've mastered a symptom, we know the symptom imperative can come rushing in. And one of the reasons for that is that usually we haven't mastered our kind of emotions column entirely. Who does? Our emotional life kind of flows. And I would think of it more as in relation to that action step that I have where I say your body is a flowing emotion. Try to think about your emotions column that way, Catherine. In other words, it's not a failure that you had a new symptom. And it doesn't mean that you haven't arrived where you need to go. It actually means, I see. Charming L said I submitted a question, but it's not showing. Should I ask on YouTube instead? You can do that, or you can just try again here. Try again right now. I'll let you know if it comes through on Instagram. If not, then yes, try on YouTube. So Catherine, I don't want you to see that as a failure. I want you to think of your body as an expression of your mind. And so anybody can have a new symptom come up. It happens to me all the time. I know about my emotions, and I sometimes even know which emotion I'm having. But we have to remember your body is the most empathic entity we have. It's so empathic to you that even when you're hurting, it's going to hurt with you. some of the time. Not all the time, but often enough. And just think of it that way, that it is empathizing with you. And it's just a chance for you to understand what's going on. Now, sometimes that can come from repression. Sometimes it can just come from the fact that you know what the feeling is, but it feels it even more deeply. And I suppose that is a form of repression. It's like you're not repressing the feeling itself, but maybe the depth of it. Just take your body at its word. Trust that it's saying something important and go with that. Catherine, let me know if that makes sense to you. Sylvia, as a follow-up, but I think I get what you are saying, that the drug changes your mind. Maybe if you get a lot of pain relief with the drug, then without it, you are missing that relief, and it can seem like rebound. That's one very good example, Sylvia, and it's very good thinking on your part. I want to encourage you, Charming L, it does look like your question came through, so I'll get to it in a second. But that's one example, Sylvia, of the kind of things that can happen. I mean, think about those. They're just rats, but even the rats, they're receiving a stimulus. When that stimulus stops, think of how confusing that must be. Think of how confusing it is for human beings to have a medication that alters things. Rats would have no idea what's going on. They could be completely messed up from that and be processing all kinds of things in their bodies from the threat of it. In fact, this is a good way of thinking about it. When these rats are given medication, what is the likelihood that they feel that they're in danger? I would say it's very, very high. Some substance has been injected into them, probably by an actual injection. They don't know what it's about. They don't feel like themselves. And suddenly they're supposed to be normal. So the fact that there are these cortical spreading depression, elements in them, it makes sense. They've been through something. This is the kind of thing that I get. I'm certainly not frustrated with you about it, but I can get frustrated with the research mentality. They want to make it simple where it isn't simple, and they want to make it complicated where it isn't complicated. They're often backwards in this. And so in this case, they're making it way, way too simple by saying, no, emotional response isn't that big of a deal, or the mental response isn't that big of a deal. And then they go ahead and make it super, super complicated when they're like, well, neural pathways, they really change things, and then you're kind of stuck with them, and there's a lot of depends, and different people are different. That they're making it complicated in ways it isn't complicated, and they're making it simple in ways it is not simple. So we just have to think about that. We have to think about what the setup is and how we can kind of consider that. Okay, Celeste Novachrono has a question. She says, what are your thoughts on tinnitus being a mind-body symptom? It started as my general pain went down. Okay, tinnitus is almost always a mind-body symptom, Celeste. I've had it myself. Many people have. I have worked with people on it, cured them of it. I'm going to put in quotes because curing is not exactly what we do, but we manage symptoms so we can get them to go away. So if that's not a cure, I don't know what is. Tinnitus can happen for multiple reasons, just like any symptom can happen for multiple reasons. It can happen for a purely physical reason, like if there's an explosion right next to you and you have tinnitus afterwards for a little while, that's probably not all mind body, though it could be some. It's probably at least partially just physiological. But tinnitus can also happen just like anything else for mind body reasons. If the body can do it for one reason, it can do it for mind body reasons. And in fact, tinnitus is a very common one. Part of it is because tinnitus is attentional. And it's interesting. Whenever I talk about tinnitus on here, or really anywhere, I'm aware of the fact that there's a slight danger that it will trigger people into having tinnitus. So just be aware of that. And you can always make it go away. It's not going to get stuck there. But I even need to do it myself just by, having it brought up. It's actually a very, very common one. So Celeste, let me know if that makes sense to you. I can say more about it in specific. But if you think about it starting as your general pain went down, that's a good indication. The timing doesn't make sense that it would suddenly be there just randomly. It's probably tied to that. And in fact, I would say that is exactly what it is. Okay, we have a question coming in from Facebook. Then I'll get to you, Charming L, and Positively Whitney. Thanks for joining us on Instagram. Then Molly, I see your comments. I will get to you in a second. This is from Facebook, my friend Ross Mark. No triggers last week. Feeling good. Okay, so if you were here last week, Ross had been triggered at work and he was asking me how to deal with it. It was a very good question. He said, had a softball game and had 2 home runs. All right. He's obviously feeling good. Do you think Juwan Howard, the Michigan coach, has anger issues? Okay. So if you weren't following the story, Juwan Howard is the coach of Michigan, got in an altercation with an assistant coach from Wisconsin. Now, does he have anger issues? Really an interesting question. First of all, because I don't know him directly at all, I couldn't say. I'd probably have to know more about it. But I don't think you have to have anger issues to get angry or get in a fight. It's the human condition for that potentially to happen. Who knows what happened and why he snapped. Now, if this is happening regularly, I would say, okay, well, maybe that's more likely. But even then, I want to be a little careful about labeling anybody as having anger issues. To me, everybody's a human being. We all have all of these feelings. I don't think anybody has anger issues or doesn't have anger issues. There are people who know how to handle it better or not. But listen, a lot of the people who quote unquote know how to handle it better are people like me and people like many of you who are suffering from pain because we manage the anger. We keep it inside and then the body expresses it. So ultimately, whether you're having angry outbursts or you're having symptoms, we have to find a way to deal with it in a smooth way that allows us to address what is needed. And from a goodist perspective, we usually want to do it in ways where people actually like us at the same time, and that's part of the challenge. Okay, hope that answers the question. All right, we have a question from Charming L. How do I overcome the fear of feeling good? Okay, fantastic question. The fear of feeling good. This is something that I would say relates to power column work. Often, when I help people reduce doubt, they find that doubt comes crashing in when they start to feel good. Or said another way, when they start to feel powerful. So you're asking a very important question here, L. How do I overcome the fear of feeling good? To me, the way you overcome anything is to understand it. We've got to get this articulated. We have to help you figure out why. Why do you fear feeling good? I'm just going to give you an example. Of course, I don't know you, so I have no idea if this applies. In fact, it probably wouldn't. But some people have a fear of feeling good because somewhere in their lives, they have somebody who's actually not going to be happy about it. They don't want to give them permission. Sometimes a parent actually is quite competitive with you, doesn't want you to feel good. Or sometimes you have a sibling and you feel guilty about feeling good. Or sometimes you feel you're going to be punished for feeling good. So we need to pinpoint why. The power column work is very helpful for this. And I can't stress this enough. If you're not sure what that means, I really do encourage you, come to the seminars, come to the groups. I can explain it in much more detail. I'll get into it here some, but there we really get into the nuts and bolts of what is the power column? How do you work at it? And so your question, how do I overcome the fear of feeling good? To me, it's mostly power column work. And that means, figuring out what your core narrative is so that you can kind of figure out who your main suffering self is and what that story is and what you're going to do about it. And then learn to recognize when you're in power or out of power and make adjustments. I'll be able to make recommendations, though, when I know you better. So those are some things to think about. All right. Let's see. Molly Maid changed her name, which she references. She says, by the way, I changed my channel name again. Haha. So Molly Maid says, hi. So I get this sore skin once in a while and then it goes away. I told my husband about this and he said, oh yeah, I get that too. I asked him if it bothers him and he said, no, LOL. My point is he gets it and it goes away. I get it and worry what it is, LOL. It is like a nerve thing, I think, with the skin, just like tender to the touch. Okay, let's leave that up there. Molly, thank you for sharing this. It's a really important set of observations. If we think about it this way, we could say, well, look, it's interesting. You and your husband get the same thing, but this is where the doubt column takes over from the emotions column. The doubt column takes the baton and runs with it. If you're more bothered by it or more worried by it, then that is more room for doubt to play. I'm, of course, not saying that critically. So many of us in this community are going to have things like that. But I want you to think about it that way because it shows that's why it develops, which I think is actually what you were getting at anyway. I don't think you didn't know this, but I'm saying it for illustration for the people here. So let's think about it that way, Molly, and start to challenge whatever fear you might have. I want you to use moment-to-moment thinking and think, maybe I can make this go away now. Maybe I can actually make it go away faster than my husband does. Start to think about it in that way. Challenge it. Let's see where it goes. Okay, Sylvia says, thanks, Dan. I think I'm getting it, although I might still need some more convincing because of the other studies I read. But I think I see the correlation, not causation argument you were making. Okay, that sounds good, Sylvia. We'll keep talking about it. You're doing the right thing, by the way. Don't let it go. If you still have something that is bothering you, eating away at you about it, and you're not sure what it is, keep asking the questions. Sylvia's doing a good job with this in more ways than one. She's continuing to ask the questions, but she's doing it with A questions as opposed to B questions. Remember, A questions are the questions that are designed to get you more information and further you in your process. She's legitimately asking these questions. Sometimes people ask questions and they think they're legitimate questions, but they're really B questions. They're driven by doubt. They're meant to build their own fear and sometimes the fear of others. Sylvia's not doing that. She's just going after the answers. She wants an answer that can help. And I appreciate the way you're doing it, Sylvia. Okay, Talia says, an ENT told me tinnitus can fill in frequencies or repeat patterns, i.e. can be mind-body. Okay, so there's an explanation that an ENT is giving about why it might happen. And that makes perfect sense to me. But again, to me, everything can be mind-body, pretty much. Anything that the body can do. The system is already there. All it takes is for the brain to co-opt it. And with peptides, it can take over any cell at any time. If you guys need to know more about that, please tell me. I talk about it in the seminars all the time. Occasionally it comes up in the groups as well. Sometimes here, but let me know if you need more information on it. Okay. Let's see. How to heal chronic pain. Scotty said, haha, yes, I had suggestible tinnitus after hearing these discussions last summer. Yep, it can definitely happen. La, 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 la. Let's not get in that way of thinking. But if you do, don't worry about it. With the skin, with anything, everything is temporary. Everything is acute. Okay, Karen says, I feel so safe among this group hearing all you say, Dan. No wonder I want to be around you all. I love that I have the group in my toolbox. Thank you so much, Karen. It's sweet of you to say, and we're lucky to have you too. Karen also, she often goes on Instagram and different places and recommends this, and other people in the mind-body community have really helped her, including Nicole Sachs, Howard Schubiner, and Dr. Sarno. So thank you for including me, and Dan Buglio also. So thanks for including me in that, Karen. I really appreciate it, and thank you for joining us. Okay, let's see. Sylvia has another question. Here's another question. She says, might have asked before, but when when I shift sides, it's not an onset or uptick, right? Usually there is some relief when it switches sides, but is there doubt present if it lingers? Interesting question. Okay, then there's a continuation to this. Like I have worse pain on my right side, or that's how it feels. When it shifts to the left, I'm relieved, but then it just hangs out on the left until it starts up on the right again. Okay, I'll leave that up there, please. This is a very typical experience, and here's what I'd say about it. I think that the shifts are related to actually changes in your thinking. They're not just random. There's something that's going on there. But the fact that it essentially just shifts over and then doesn't relent is a very doubt column sort of issue. I would think of this as kind of a symptom imperative, but it's a very specific symptom imperative. And the relief is, I guess the way I would describe this, Sylvia, is that essentially what you're saying to yourself with these symptoms, unconsciously, is the idea that, oh, well, this is relieving to know it can shift. I'm not stuck with this, but I'm kind of stuck with it anyway because it doesn't fully go away. That's a form of doubt. I believe I can get better, but not all the way. So I want you to think about that. And Sylvia was saying, sorry, when the pain shifts sides is what she meant, which I think we got. So think about it that way, Sylvia. The pain is shifting around almost like you're entertaining that I think it can shift, but I'm not sure I can make it go away entirely. You don't have the full confidence yet. So this is doubt column work. Absolutely. Let me know if that makes sense to you. Okay, Sue Conte says, I have differing levels of stiffness in my legs. Is that TMS? Yes, it is. Now listen, is it possible to have, stiffness in your legs for some purely medical reason? It is. And go get it checked out if you have any real concerns about it. But I find it very hard to believe that it wouldn't be mind-body. And in fact, it just sounds like the kind of thing that would be mind-body. So I would ask Sue, how long has it been going on? Has it been connected to anything emotional in its onset? And most importantly, doubt, because it sounds like it's there kind of more regularly. So what's the doubt? Let's start with the opposite question. You say, is that TMS? I want to ask you, why do you think it isn't? And I'm not saying that in any kind of critical way. It's meant to support you, and it's meant as an exercise to get you where you need to go. So let's take it from there. But can that be TMS? Just like with tinnitus or any other symptom, if the body can do it, it can be used for mind-body processing. Okay? Let's see here. Katya Isabella, good to see you here on Instagram. And Karen says, yes, I'll scream it from the rooftops. Thank you so much, Karen. Okay, Elle, I'm going to get to your question in a second, but I have a couple to catch up on YouTube, and then I will get to your question. Catherine Toomer says, yes, and I do think I know the emotions. So I'm going to get back. This is when we were talking about the rib cage pain that began after plantar fasciitis. She said, yes, and I do think I know the emotions, and one was so painful that I felt very overwhelmed and not liking myself. I think I convinced my body that I couldn't handle the emotion, but really I want to handle it, and I don't want rib cage pain. This is something that Sarno said that I totally agree about. When push comes to shove, people would rather have the emotion than the physical symptom. It's not rational. We don't choose it that way on purpose from a conscious standpoint. Unconsciously, we choose it. One of the advantages of the column system and a mind-body work in general is we start to get it into conscious thinking. We get to control it. We get to make the choice. So if you've got the right information, Catherine, you will be able to make that choice. I want to know the emotional pain. I don't want the symptom. Then she said, however, once I fully agreed with myself that the ribcage pain was TMS, it has already started diminishing. That is the doubt column at work right there. It's interesting because it was about the emotions column, but the thrust of it had become doubt. Doubt takes the baton and runs. I said this in the seminar earlier today. Emotions are the match that lights the flame, but doubt is the gasoline. It keeps it going. The fire would just go out without the doubt, and that's what's happening there. So, Catherine, when you resolve that, you got relief. I'm glad to see it. Okay, Napoleon, welcome back. He has 2 parts. Hey there. I want to give an update. See, I started to practice aerial silk. I don't know what that is. A month ago, and was like put off the IBS completely, but I started to have a lot of arm pains. I'll have to figure out what aerial silk is. I don't know if it was a typo or if there's just something I don't know about, which can happen. I went to my PT and she couldn't find anything wrong, I think, with my neck or arms or tendons. So I'm sure it's TMS. The pain went down a bit, and then my back started to hurt every time that I'm working, or at least most of the time. Okay, so Napoleon, tell me more about you're updating us, and I appreciate that, and I want to help you with this. What I want to know is what do you most need to address your columns work right now? For instance, are you saying that when these things happened, it made you have doubt? Or are you saying, I noticed that it worked for the one symptom, but then the symptom imperative came in. So the doubt is now, it's always going to be something. This is one of those examples of needing to get the doubt articulated. Okay? So when we're looking at doubt, there are 3 steps, and I've developed this more recently, but we observe the doubt first. Observing the doubt means seeing that it's there, but it also means not buying into it. You're not observing doubt if you think it's fact. You have to see it as doubt. Even if you don't believe that it's wrong, you have to at least be entertaining it might be wrong, because that's what doubt is. After that, we got to get it articulated. I'd say in this case, Napoleon, there's a doubt to get articulated. If I'm going to help you counter it, we need to get it articulated. So let's try with that. Get it articulated, and we'll go from there. And that can happen either today in this Q&A, or if you want to contact me separately at dan@crushingdoubt.org, please do, or come back to the next Q&A. We'll get to it there. Okay, let's get to Charming L again. Charming L says, it's like I'm constantly waiting for the other shoe to drop. There's that old saying, every time I take 1 step forward, I'm knocked 3 steps backwards. I hope that makes sense. The age-old saying. So, L, you make perfect sense. Many, many people have said that many times, and I absolutely understand. What I hear in it, though, and I hope this is helpful, is that there's doubt that's forming these words in your mind. Even the math, you're saying every step I take forward is 3 steps back. That's the kind of thing that doubt says. I want you more to think of it as maybe I prefer this math. I take 2 steps forward and it's 1 step back. Because if you can get to at least that mathematical model, if you can believe it and it feels right, then at least you're moving forward. Doubt is often convincing you, nope, you're not moving forward. You're moving backwards. Power column work, which is what I was talking to you about before, that's the thing that can open the door to you feeling safe to feel good. And that's the problem that you're running into. So I highly recommend either coming to the seminar, or I have the seminars available on video. You can get those on our website, www.crushingdoubt.org, and or come to the groups. They're very power column focused these days because a lot of people have been in them for a while. They've gotten their doubt down. They've kind of figured out their emotions column themes in large measure. This is not true across the board. It's a mix. But a lot of people are right at that point where doubt and power meet. And if you can get doubt to ease its way down and you can feel safe in power, you can get there. So that could change the narrative entirely. And you could find that you're no longer waiting for the other shoe to drop. You could find you're just wearing your shoes comfortably and happily. Elia Gomez, thanks you for joining us on Instagram. Good to see you here. Okay, Bob says, Elle, let me know if I answered your question well enough. Okay, Bob says, peptides can initiate anywhere in the body, not just the brain. I keep hearing about emotions getting stuck in the body. So could the stomach initiate peptide changes with reducing acid reflux? That's an interesting question, Bob. I think that I would say that I like to think of it as the brain controls everything. The stomach, the gut, has the second most neurons in the body. So it is kind of like a mini brain. And that's why you can kind of think with your gut, actually, literally. But would I say that peptides get initiated in the stomach? It's possible. Peptides go throughout the body, and given that there's all those neurons there, that's absolutely possible. To me, it doesn't even matter so much. What matters most, I suppose it matters if it doesn't make sense to you, because everything has to make sense to you. But what matters most to me is simply the idea of peptides in general, which is that your mental state, whether it's from the gut or the head, although I would say the head controls the gut as well, because it has more neurons, and it's processing more at a higher level. So I think that you could say that peptides are affecting change in the body no matter what, from an emotional state. That probably does happen from the gut, because when you think about it, our cerebral cortex, the part of our brain that does even more sophisticated thinking, that's only in the brain. But we have parts of our body and parts of our central nervous system that experience fear and lack of safety and all kinds of things right from the start without processing it. The brainstem, it's evolutionary. It's just responding to survival. Your gut instincts, you think without fully thinking. You're just kind of processing it very quickly. So it's certainly possible, Bob. But I think the main point is wherever it comes from, peptides can definitely initiate acid reflux. They can control any cell in the body in any way that they want. Let me know if that makes sense. Molly Maid says, are people with mind body the types that had a lot of worry and anxiety when they were a child? I know I was an anxious child. So yeah, I would say that it's much, I would say it's a strong risk factor for mind-body issues if you're an anxious child. But there's another way of thinking about that. Anxiety as a child also means that you were processing a lot of things in a more direct way. Sometimes an anxious child, I'll put in quotes, is one that is further advanced. They know what's up. And that's not always the case. Sometimes anxiety can come when you don't know what's up and you're misunderstanding something. But a lot of times it comes from kids who can pick up on what's happening. They know what's happening. They're processing it, and they know that they've got to behave in certain ways to manage certain things. Sometimes they might be protecting their parents, things like that. And they are thus more likely to channel their feelings into the body. So a better way of thinking, or not a better way of thinking about it, but another way of thinking about it, Molly, is that anxious kids are also ones who tend towards a more sophisticated defense. They're taking in more about what's happening. And as a result, they're more likely to use a more sophisticated defense. The more sophisticated the defense, the better it is for other people. It's less of a problem for other people, and it's even less problematic for the person themselves, believe it or not, as bad as these symptoms may be. They're minimizing the damage to everyone else and just falling on the grenade. And so to me, that's part of what's going on with an anxious kid. Now, Sylvia says, all right, so I figured that for a while, the shifting and lingering is doubt. But how the heck do I get over that? Like, what more can I do? I keep telling it, like, you don't need to linger, no peace treaty, etc. But this is just continuing. Okay, so Sylvia, think about it this way. I guess the way I would phrase it is, when you ask the question, what more can I do? Essentially what you're saying is, doubt has me beat here. I don't think that this can go away. So we're at that phase of doubt, of observing again. Back up. I think you're trying to counter it. And it makes sense that you are. I'm not saying it critically, but I just want you to remember the 3 steps. Observe, articulate, then counter. So many times when I tell people to deal with doubt, they try to counter right away. Not necessarily right away, but they spend the bulk of their time countering. And they can forget, go back to those earlier steps. They especially forget observe. They think they've observed it. They're like, no, I know it's there. Yeah, I see it's doubt. But if you're seeing it as doubt, but not exactly doubt, like, okay, I see the idea, but I actually think it's true, that's not observing the doubt. So I want you to back up, Sylvia, observe this doubt. Recognize that what you're saying, and we can get it articulated too, is, I don't think this can go away. And I want to know why. So let's have you answer that question. Because you say, like, what more can I do? I don't want you to think you have to do so much here. But I think that what's happening is you're thinking about countering. And I want you to think about observing first. Let me know if that makes sense. Okay, Napoleon has an update for us. And Bell27, it's good to see you on Instagram. Napoleon says, yes, makes me doubt it's a risk and fun activity. Aerial silk, it's like yoga. Okay. But on cloths in the middle of the air. Wow. That sounds pretty cool. But I try to trust my body. I don't hurt all the time, but always something gets my attention. Okay, now, Napoleon, I just want to back up now that I understand what aerial silk is. Okay, so you're dealing with these shifting pains. And you say, I try to trust my body. I don't hurt all the time, but always something gets my attention. To me, Napoleon, what I would recommend here is to use the columns to figure out why you have the symptoms you have at the time you have it. You're almost there. You're making lots of good observations. You've come a long way, but we need to get more specific as to why is it happening then. Courtney, I see there's a comment possibly from Facebook. Was that meant for me? No. Okay. Ignore. Not from Facebook. All right. Now, Molly Maid says, my gut brain needs to shut up. LOL. Yep. I think a lot of people feel that. Now, Molly has this question. What is a peptide? Thank you for asking that, Molly. There's probably many people who wanted to ask that question, and you did it for them. So thank you. I should have said more about it. A peptide is basically the equivalent of a neurotransmitter. A neurotransmitter is the substance that communicates between cells in the brain. So one cell of the brain tells the other cell in the brain to do something with a neurotransmitter. A peptide is that same thing, but it's used between your brain and your whole body. So it's like it could send a command in the bloodstream and tell that cell to get rid of all its water or to fire pain receptors. I don't actually understand cellular biology that well, so I don't totally know that exactly. But what I do know is it's got control over everything, all the way to the cellular level. And that's why there's things like gene upregulation. Things can get activated by the brain. And I don't say that to have it be scary, because actually I think as you come to know yourself and be in touch with your feelings and the columns get set, you're in far less danger of that kind of thing happening. But a peptide essentially is a messenger from the brain that can control the body in whatever way it wants to. And if the system is there for it to work, the physical system, then it can happen for a mind-body reason. Now we're going to wrap up on a couple more questions here. Sylvia Sierra says, I guess the problem is I don't feel like I have doubt about this. Like I believe that lingering pain is nonsense and that it can and should go away. I have no idea why it should linger. Okay, Sylvia, you don't have doubt that it is mind-body. You have doubt that it will go away. That's a very different kind of doubt. And I don't blame you for it, but I just wanted to distinguish between the two. And actually, I shouldn't even presume. I don't know that you have that, but that's what it sounds like. So if you don't have that, push back. Let's keep going after this. What I can tell you is you make sense and your symptoms make sense. We need to understand how. And so you're asking the right questions. Let's see if it makes a distinction, though, so far. And we'll, talk more about this next week, unless you have a quick thing to say now, about the idea that you don't have doubt that it's mind-body, but you may have doubt about whether it will go away, or maybe whether you can make it go away. Level 3 doubt. Sounds like level 2 doubt to me. Okay, now Sylvia says, I don't feel like I have doubt about it going away. Okay, good. But Sylvia, you still have questions about it. Remember, questions are a form of doubt. So you're asking, why won't it go away? Well, you need an answer to that question. So maybe maybe that isn't how you'd think about doubt, but I think of doubt very broadly. So you sound pretty confident, and that's great, but you have a question. And then Sylvia said, it should definitely go away, LOL. I totally agree. But the question is, why do you think it hasn't? Until we get an answer to that, you're going to have doubt because you have a question. Does that make sense? Let me know if it makes sense. I'm going to answer Dorisa, and then we got to wrap up for today. Dorisa said, I also have an issue that won't go away. I agree with the gut brain needs to shut up. Okay, so listen, anytime you guys have a symptom that won't go away, there is an answer. We just need to think about why. The columns give us that system. Okay, first you assess, am I in trauma or not? Then you figure out which column is the predominant one. Then you figure out what's the broad issue within that column, and then the specific. But there is a reason. There's always a reason. And it could be that doubt hides in the idea that maybe there isn't a reason for this one. Or maybe it'll just get stuck. Doubt is very subtle. So I just want to encourage you guys that sometimes you'll say, I don't have any doubt. If the symptom's not going away, the system's suggesting you do have some kind of doubt. I don't mean that insultingly or as bad news. It's just another chance to look at it. So go ahead and take a look at it again, and let's see what we can find. I am 100% confident we can find out the answers. And I've got the system to do it. So let's keep at it. Thank you so much for your questions, guys. I look forward to talking with you again next week. As always, if you need anything from me, you can find most of it on www.crushingdoubt.org. That includes signing up for the seminars. We are going to be wrapping up our current seminar later this week, but it will be on recording. If you want to catch that particular one, you can order the video group. It's not too late to join if you want to catch up also, so just let me know. The group memberships are also available, and come get the resources that I'm giving out, and let's make sure that you utilize them. Get your questions answered. Keep asking those A questions, and catch yourself if you're asking B questions. It happens to us all. Focus on the questions that are going to further your understanding of things. Okay, Bob says, thank you, everyone, and thank you, Bob. And thank you for the confetti and hand clapping, Scotty. Appreciate it. Thanks so much, guys. I will see you same time next week, Mondays, 6 p.m. Eastern, 3 p.m. Pacific. Thanks so much.